Three things I avoid as a brain doctor and pain doctor. Number one, I would never let a chiropractor touch my neck. And the reason for that is basically that in the neck you have two very important blood vessels. One of them is called the vertebral artery, the other one is called the carotid. And these are basically the main source of blood supply to your brain. Now, what can happen in chiropractic neck manipulation, specifically neck cracking or HVLA, high velocity, low amplitude manipulation, that can potentially lead to dissection in those vessels. So that's a tear inside the blood vessel. And when that happens, basically you can get a stroke. So simply not worth the risk. There's safer options like physical therapy, massages, acupuncture. Number two, deadlifting. Deadlifting is probably the exercise that's the most highly associated with back injury. And the reason for that is that you're putting a lot of pressure on those L5 and S1 vertebra. Whenever you're doing the deadlift, you're putting a lot of pressure on that disc, and that basically puts you at risk for disc herniation and compression of the nerve roots, right? So sciatica-like pain. And there's safer options like squats and other things you can do at the gym. And then the third thing I would never do is weight.
Yeah, I would agree with all three of those. Chiropractic adjustment in the neck. Now, I think he overestimates the risk involved with that. I don't think it's that much of a risk. It's like a 1 in 100 or 5 in 100,000 cases may have an injury to the vertebral artery, which, by the way, if that happens, you're having a stroke. So, think about what you want to do, but it's not very often. It's usually very well tolerated, and it does help a lot of people. And so I'm not going to criticize that manipulation, although we don't do it for a very similar reason. There's better techniques, in my opinion. And then the second one is deadlifts. I am not a fan of deadlifts to a certain extent. I don't mind deadlifts if they are low weight, high rep, but then when you flip it and you're really trying to max out that weight for muscular strength, I think that's a big no-no, mainly because of what the muscles are designed to do. Lower back muscles are designed not to be very strong, but have a very high endurance. And so when you train that out of them and they aren't able to do that very much, it can lead to more back pain. Putting pressure on the discs, I mean, the reality is we're going to have to lift stuff. Our bodies are designed to lift. The discs are designed to be loaded. And so I don't think that's a problem. I disagree with him there. Where I have the problem is when you start deadlifting 300, 400, 500 pounds, maybe 2 or 3 times, or just maxing, doing a 1 rep max. When you do that, you're going to really train out the purpose of your lower back muscles, which then predisposes you to future injury. And so I really am not a fan of that. And then, don't wait to get treated if you have problems. He specifically noted neurologic symptoms, but the reality is that anytime you have even just a mild discomfort or back pain, if it doesn't go away within 4 weeks, 4 to 6 weeks, at most, you should go seek out treatment. The reality is that little problems become big problems, and big problems are harder to solve than little problems. So